According to a number of reports, some Black Americans say they're hesitant to trust the new COVID-19 vaccine, and now doctors are working to change people's minds.
Dr. Derek Robinson is among those doctors, and he joins us today to tell us about the efforts. Dr. Robinson, thank you for joining us this morning.
Good morning, Lauren and Ashley. Pleasure to be with you.
Thank you. Thank you. So let's get right into it. Tell us, how are Black doctors coping during this pandemic with everything going on?
This has been a really challenging time for Black physicians. We're more likely to serve patients that live in underserved and Black and brown communities. And those communities before the pandemic faced a lot of adverse social determinants, a lot of disadvantages, and those have placed them at higher risk for getting infected, being hospitalized, and unfortunately dying from COVID-19. And so Black physicians have seen a lot of deaths, and we're accustomed to being able to help our patients. And with COVID-19, it's been very challenging due to the limited treatments available. I think the other thing that we've experienced is an increased awareness of our own mortality and the mortality of our friends and family as we move through this pandemic.
Yeah, and just like you mentioned, Black Americans have been disproportionately affected by this virus. So I want to know, what do you believe needs to be done to convince the Black community to take the vaccine?
That's a great question. So first, I think we need to acknowledge concerns that the Black community has. They're valid, and they're the result of broken trust between the Black community and the healthcare community, which goes back many years. I think we also then need to ensure the Black community understands what the risk factors are. So we're more likely to be essential workers, we're more likely to use public transportation, more likely to have some of the chronic issue at higher risk for having a complicated clinical course and a higher risk of death with COVID-19. I think we then need to see healthcare workers getting vaccinated, which we see happening all across the nation. That gives folks hope and makes them feel like less likely that they're being used as a guinea pig. But then I think probably most importantly is they need to see physicians that look like them and scientists that look like them explaining what's going on with the vaccine and sharing the data that's available regarding the vaccine. And I think that's critically important. I plan to get the vaccine next week at the hospital where I work. My wife is also a physician, and she'll be getting vaccinated next week as well.
And you've been touching on this, the fact that we've been seeing, people of color getting vaccinated, and you just said you guys are expected to get the vaccine next week. What's going through your head, and how are you feeling about it?
I'm feeling good. This is a little bit of a light at the end of a very long and dark tunnel that I think we all lived through. I think transparency has been an important component both in my decision making and I think also for the society at large. I've had a chance to look at the data regarding the vaccines that have received emergency approval. And I think that information is powerful to share with individuals so that they understand what the opportunity is ahead. Again, we know that, the best things that we have right now is wearing a mask, socially distancing, and washing our hands, good hand hygiene. And those are things that people are going to need to continue to do even after getting the vaccine. But I think this is a very promising development.
And just like you mentioned, it's something that you're going to have to continue to do, washing your hands, wearing your mask. What do you say to those people out there who are like, okay, I got the vaccine, that means I'm good, I don't have to wear a mask anymore? What do you tell them?
Not the case. So one is that it takes a little while to develop immunity, even like if you're getting a flu vaccine. That's why we recommend that folks get that at least several weeks before that season comes around. So the vaccines, the Pfizer vaccine that's been released and the Moderna vaccine, which is in the pipeline, are both 2-dose vaccines. And so what individuals will need to do is get their first dose, followed by the second dose. And in a period of time after the second dose passes, the reports show that individuals will develop immunity. But it's going to be important to continue to wear your mask, continue to socially distance. There's still some information we don't have, and that's whether individuals can be asymptomatic carriers of the virus after being vaccinated. So those are things we're going to learn over time, but we definitely think that's the right direction to head in. But we definitely need folks to continue to wear their masks, continue to socially distance, and continue to wash their hands.
Thank you so much, Dr. Robinson. This is so important to talk about right now because you see it all over social media, and then you see people posting false
information
in these articles saying, oh, don't take the vaccine, because even I saw one on my Facebook saying because you'll turn into a zombie and all these scare tactics. You know, what do people need to just look out for when looking for this information? Should they just go directly to the CDC's website?
There's a lot of good information available at your public health department. So whether it's the CDC, your state health department, or your local health department are good sources of information. The internet can be a dangerous place, and certainly in social media, a lot of information gets exchanged back and forth. And unfortunately, there's some myths out there that are doing a lot of harm. And so we need to ensure that people are being properly informed, properly educated about both ways that they can protect themselves from COVID-19, but more importantly, also the facts regarding the vaccine and its potential benefits. And so we encourage people to use those reliable sources of information.
Perfect. Thank you so much.
Thank you. I do have one more question.
Thank you for the opportunity to be with you. Yeah.
For those who, you know, after I guess they get the vaccine, or people who have already taken it, after they get the vaccine, then what? You know, there's some people who might question, so what happens now? Does the world just get the vaccine and everything's okay? I think some people are wondering about the aftermath of, okay, the vaccine is here, we've taken it, what happens then?
So our public health officials have said we need to reach around that 75–80% herd immunity. So we need to get many, many individuals in our society vaccinated against COVID-19. That's going to allow us to really help eliminate the presence of COVID-19 in our communities locally and around the country. So we've got a ways to go. The great thing is that we've got great production of vaccines that are underway. And it's going to be a while before this vaccine is available to every individual in the country. It's starting off with our frontline healthcare workers, and we'll move through that tiered system recommended by the ACIP as we move through the weeks and months that are ahead.
Wow. Thank you so much for that, Dr. Robinson.
We appreciate that information, seriously, because this is so important right now. Thank you.
It is. Thank you, ladies. Have a great day.